All right, this next section is going to take a look at the issue of should the United States adopt universal health care? Some definitions to start off. As the name implies, the authors remind us, universal health care refers to the medical coverage and services that are sanctioned and guaranteed by the government and provided to all the citizens of a country. Now contrast something. Many Western European nations view some sort of universal access to health care not only as a legal right, but also a moral one. However, the United States has never had full-blown universal health care, and only rather recently has started the process of trying to guarantee its citizens basic health care as a fundamental right. So the most recent important thing is the United States Supreme Court in the summer of 2012 ruling that the Patient Protection and Affordable Care Act does not violate the United States Constitution. This particular act requires, you may recall, that all U.S. citizens have to purchase health insurance or else face penalties in the form of various fines and taxes. So this particular universal requirement in the Affordable Care Act is known as the individual or insurance mandate. Now, U.S. citizens already actually pay some taxes for a kind of somewhat universal health care. They call it quasi-universal health care for some segments of its population. In particular, the U.S. Offers what is known as single-payer healthcare assistance to veterans and their families, whether active or retired, various Indian tribes, prisoners of certain kinds, as well as the CHIP program, Children's Health Insurance Program, and Medicaid and Medicare. Now, the two authors in our section, John Gaiman and Glenn Whitman, take different sides. Gaiman, in the first chapter, looks at how healthcare is a fundamental right, not just a privilege. He thinks that it exists for patients with medical needs, and so as a consequence, a healthcare system should be a public service, just like fire and police, that's not based on an ability to pay for services rendered, nor should healthcare be a commodity for sale in the marketplace, which has as its goal the profiting of corporate stakeholders. Now, on the other side of the issue would be Glenn Whitman. He argues against a single-payer universal health care system, and one of his cluster of reasons is that Americans' health care, if we went to a single-payer universal health care system, would be rationed by means of budgets outside of the United States. It would also be affected by caps on the availability of treatments and drugs. It would also be characterized by denials of service, by a bureaucracy, and most of all, waiting. So the recent scandal within the Veterans Affairs Administration, that healthcare program within the U.S., makes a lot of people worried that if the government has a poor job of handling even some of those quasi-universal healthcare programs that it administers and requiring people to have long waits and so on, perhaps it's not up to the task of doing something more broad for the entire nation. But this is an important topic, and I think that our readings get into it very well.